Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
But a mission to
Delivery of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Nicolle Fletcher. She is chair of the Doula Alliance of Arkansas, a founder of Ujima Maternity Network, a certified birth doula, and the founder of Nurturing Arrows Birth Services. Nicolle, thanks for being here today.
Thanks for having me.
You are very much considered to be an expert in the role of a doula. Tell us what that is.
So the role of a doula is non-medical, emotional, physical, informational support and advocacy for women during the childbearing years. So that's really it in a nutshell. That's what we do.
So it doesn't play a medical role per se.
Correct. So it's ancillary support. So the role of the doula is, again, non-medical, but really filling in that emotional part of the journey of labor. Information, because this is brand new for many families. And even if you've done it multiple times, there's still room for I need to know more. Just because you have a baby doesn't mean you know everything about having a baby. And so that informational support, that advocacy piece, really kind of helping a family navigate the unfamiliar terrain of a hospital setting is often really big. And then comfort, right? That physical support, allowing a woman to experience as much comfort as she possibly can during the laboring experience. But it doesn't stop there. It's not just at the moment of delivery or during that time. It is up to 12 months postpartum. And we know that women are suffering in the state of Arkansas and also nationally after delivery. And so there's a lot of mental health issues. There are a lot of things that come into play in the postpartum period where the role of the doula can really be impactful and even life-saving.
And this can play a role in helping with maternal health disparities in our state too. How does that work?
Absolutely. So, when we're dealing with the maternal health care disparities, right? So we know from the Arkansas Maternal Mortality Review Committee that 92% of the mortalities that took place are preventable. And so that gives hope. But also it says we have to figure out what's going on and get into those areas, right? So some of that is distance, that women are having to travel to even just get care. And because of regular life or standard of life, they're not making those trips. And so they're not getting the proper care that they need. And so those are some of the reasons why we're seeing some of these healthcare disparities. And also, I think with it being Black History Month right now, I think we do have to have the conversation about maternal health care and the Black community and how there's been a lot of, historically, the hospital system wasn't designed for us. We weren't allowed to be in the hospital. And so I think that plays into a lot of, I would say maybe the word that best describes it is the disconnect and the distrust. So there's a disconnect, there's distrust, and having ancillary support such as a doula that also looks like you, right? And that lives in your community, that makes a big impact and it changes the way that you view your maternal health care experience. You feel seen, you feel heard, you feel valued. In my 15-year career, there have been 2 instances where I've been in the hospital and there has been a Black OB, a Black nurse, a Black patient, and me as the Black doula. And that is an experience that most of our Caucasian counterparts have on a regular basis. And so when that moment happened, it was awing for everyone. I mean, the OB recognized it, the nurse recognized it, the patient and we all recognize that moment and how rare that moment is. And so when we're dealing with that, the disparities and the lack of trust, I think there's ownership that everybody has to play. There's parts that we can all play to improve maternal health care.
So, and you mentioned that Arkansas really is trying to help with the maternal health crisis. Tell us about how doulas play into that and what that looks like.
Yeah, I mean, This is such a beautiful time. It feels very tragic, right? On one end, but it's also a very beautiful time of change, right? Like I've defined it before as the earth is shaking. Like we are in a maternal healthcare earthquake, right? Where there have been things that have just been dormant, we've dismissed, and now we're like, we need to step into change and improving the quality of health for mothers across the state, right? Across the nation. And doulas, have been around since the beginning of time. When you look at ancient hieroglyphic writings or drawings, you see there are three people, and it's one, the person in front, that's typically considered the midwife, the woman that's birthing, and then someone is a woman that's standing behind her. And that is the role of the doula. So the doulas have been around since the beginning of time, providing that emotional, physical, and informational support, but it hasn't always been acknowledged. And so now we're at a place, again, back at that earthquake, where we are being seen for the impact that we make on maternal health care and maternal health care outcomes. And that is, it's groundbreaking. And it's a great joy for me personally. I think I've been doing this for, again, the past 15 years, going on 16, and it's been mostly unseen work, and almost like, I mean, if that's what she wants, okay, whatever. But really looking at the statistics and the data that says having a doula, not just another support person, right? It's not fulfilled in the same way with a partner. It's not fulfilled in the same way with a family member that can support. It is truly the role of a doula that makes the difference and reduces the C-section rate, reduces the rates of medical interventions, increases the rates of birth satisfaction and positive outcomes for both mom and baby. Now, I'm not going to sit here and, act like we're just waving magic wands and making everything magical, because that's not the case. But when you get down and you connect with women, expectant women at the very foundation, right where they are, it changes things for everyone.
So what is the Doula Alliance? Is that statewide?
So the Doula Alliance is statewide, and we're really excited about that. And so one of the biggest things with the Doula Alliance of Arkansas is really bringing doulas together across the state. Let's come together and really support one another. The profession as a doula, really the career span is about 2 to 5 years. That's a standard career time. And most of that is because women have to take on extra work because they're not fully compensated, enough to make it a career, to make it a profession. And so the Doula Alliance will allow support and camaraderie amongst doulas. Additionally, it just levels up the profession as a whole so that we're widely accepted by obstetricians, nurses, labor and delivery staff across the state. So there's a standard of practice and a standard of care that we are elevating through the Doula Alliance of Arkansas. And ultimately, we want to get third-party payer reimbursements. So that is, Medicaid. About 60% of Arkansans are using pregnancy Medicaid. And so we need some additional support to help the most needy Arkansans receive the care that they desperately want and need, but they often can't afford it because currently it is an out-of-pocket expense. And so the Doula Alliance of Arkansas, along with several other players. Representative Lee Johnson is championing the cause for us to get Medicaid reimbursement, private payer reimbursement, as well as standardizing the practice of doula services and doula care, which is really exciting. It's really exciting.
So what does training for a doula look like? You mentioned that there's an out-of-pocket expense for the mother, but in order to be trained and certified to do it, is it easy? Are there opportunities to do that across the state?
That's a beautiful question, because up until now, it has been some would train, at no cost. The average cost nationally is about, I'd say like $800 to $1,500, depending upon where you go. And so with that being the case, that has created a barrier where many women have just reached or felt like it was out of their reach to step into this profession. So now Ujima Maternity Network is partnered with UAMS, and we are covering the cost of doula services or doula training for women throughout the state. And that is huge. So we're looking to train 60 individuals or 60 women statewide that will then be certified as doulas. And the scholarship is $3,200, which is really exciting. And that covers the cost of Ujima's training. So with our partnership with UAMS, Ujima Maternity Network offers 600 hours of training. And that is not found in any other organization nationally. So our standards are high. We have a high expectation so that we can really put out the best and the best quality. So when they are training, they have to attend births. They attend 4 to 5 births. They have to do clinical times. They have to do prenatal times, postpartum times. They have to work with lactation. They have to sit and experience didactic training. And then we have hands-on trainings. We do clinics. They attend childbirth classes. When I talk about there's high expectations, there are high expectations. They have to write 5 book reports. They have to complete 1 research paper. And so it is a lot on them. There's a great demand, but the reason for that is because we really want to put out the best quality. We want to put the best quality of doulas out there so that birth outcomes can change, because this is not just a cute, fun activity that's done, on the weekends. We need to be at a place where this is life changing and we understand the gravity and the weight of the work that we're doing. And so you're not delivering babies. You're not, responsible for the birth outcome or the life of the mother or the baby. That's not your responsibility as a doula, but your responsibility is to link arms with that woman. And in the Greek, it's called a paraclete. So you come alongside and link arms with that woman and really, truly help her navigate, her and her family. Ujima has an initiative. It's called Fatherhood in Focus, because it's too late for men to get involved when the life of their partner is lost, right? It's too late. But what if we got in front of that and we brought some focus in maternal health care on fathers and said, you're important. And your role makes a huge impact on this mother and how she feels. So what if we equip you to work alongside that doula to support this mom? Everything changes when we have that. So that's really important for us.
And who would qualify for this training? Is it for anyone? Are there certain specifications in order to qualify for it through Ujima?
It's really anyone. So you have to apply. And then really we're looking for women that want to provide this service that live outside of Central Arkansas. Central Arkansas is pretty saturated with that support. We're definitely looking for Southeast, Southwest Arkansas, and even Northeast Arkansas. We could really use support in those areas, in those communities where women can sign up and apply. We actually have open registration where we closed it at one point. So if you live in Central Arkansas, then it's closed for you. However, if you're in the Southeast, Southwest, or Northeast regions, then apply today.
So there's a lot of big things ahead in regards to maternal care and what that looks like long term that involve doulas in Arkansas.
Yes. And it's really exciting. I mean, I can't even tell you how exciting it is to just allow the word doula to be kind of a household name, right? And so we're still building on that. There's still families that don't understand what a doula is or think that a doula is a midwife, but there's an openness to learning. There's an openness to bringing all of the support to the table. And what I like to often explain is that Ujima is a Swahili word, and it's a Kwanzaa principle. And it means collective work and responsibility, making the problems of my brother and my sister my own and solving them together. And what we see with the maternal health care crisis is the need for collaboration. We see the need, like we're not going to do improved maternal health care if we don't collaborate. And I'm meaning from the obstetrician to the check-in person, almost at the grocery store, to the lady, down the road that sees you pregnant and goes, oh, let me touch your belly, right? Like every single person has some responsibility that can improve maternal health care. And so that's kind of where we are right now. And that's the beauty of it. And so doulas are a big part of that, but also the collaboration and the willingness to almost let down the I'm the top dog or I'm the big dog in this and say, let's all put this mother at the forefront and her well-being at the forefront of this conversation, and then humble ourselves and gather around to support her to be safe and to be healthy. And, Ujima's theme this year is thriving in 2025. Survival is a low bar. And so we've talked about survival as maternal health care. Let's survive, right? And I'm like, okay, cool. But that's a really, really low bar. Survival is a low, low bar when it comes to maternal health care outcomes. So we need to be seeking to thrive. So in 2025, let's thrive.
And one last thing, how can expectant mothers or the general public, healthcare physician, all the above, how can they learn more? What are the resources that are out there to learn about doulas within the state?
Yeah. So of course you can visit the Doula Alliance of Arkansas .org. So doulaalliancear.org. You can visit ujimamaternitynetwork.org. Let me think of other resources. I think everybody is really trying to get out there. You can connect with UAMS. They are working on obviously covering the cost of doula trainings. So then there's also a network of doulas that come from there. But if you're looking for doulas in your area, the easiest and best way to find and maybe hire a doula is to connect with Ujima Maternity Network, and we can get you in contact with a doula that's in your area. Also, the Doula Alliance of Arkansas will be very helpful in that as well.
Okay. Well, Nicolle, thank you so much for joining us today and talking about this important work. I wish you the best.
Thank you.
That's it for this episode of AFMC TV. Thanks for watching and have a great day.